Good afternoon. Thank you for joining us today. I'm Caroline Young, Executive Director at Nashville Health. In Nashville Health, we work collaboratively with partners across the city to address Nashville's high priority health issues. We are really proud to join the Nashville Healthcare Council in presenting this important conversation with U.S. Surgeon General Jerome Adams. As a native Nashvilleian and health industry professional, I have been aware of the health disparities here in our city, but new data and the COVID-19 pandemic have made these gaps very real. I'm hopeful this conversation today will lead to action to better understand vulnerable populations and to ensure everyone has a chance to live a healthier life. Thanks again, and I'm pleased to hand it over to Haley Hovius, President of the Nashville Healthcare Council.
Thank you so much, Caroline, and good afternoon, everyone. I'd like to thank all of you for choosing to spend the next hour with us for our second in a three-part series on health equity and action to eliminate disparities. As you know, the Council is committed to working toward a better tomorrow by taking these first steps to better understand the long-standing inequities and injustices across many of our country's basic institutions. We're thrilled today to be able to partner with Nashville Health to explore these important issues around health equity. Now, before we get started, I'd like to take this opportunity to thank today's presenting sponsor. This is a very special thank you to Dr. Herman Williams. Herman is the Chief Physician Executive at BDO, a current board member of Nashville Health, and is an alumnus of our Council Fellows program. In addition, Dr. Williams is also the author of Clear, Living the Life You Didn't Dream of. He's a champion of change, and we can't thank him enough for personally sponsoring this important event. And now, before we get going, a couple of housekeeping notes for you. We will be taking questions via Zoom today, so please, if you have a question, just click on the chat bubble at the bottom of your screen and type in your questions, and we'll be getting to them toward the end of the program, but would love to have your input on what you'd like to hear about. And finally, after this event, you can expect to receive a survey from us, particularly during these times when we're not seeing you face to face. We can't tell you how much we value all of the feedback that you give us. And now I'd like to introduce the moderator for today's event, former U.S. Senate Majority Leader and heart transplant surgeon, Bill Frist. So I know how to introduce Senator Frist in a way that will do justice to his contribution to our community in Nashville and far further afield, nationally and globally. I think that he'd want me to tell you that in addition to holding multiple corporate and nonprofit board positions, he's a special partner at Cressy & Company and is leading the firm's philanthropic initiative, Cressy Cares. It goes without saying that we are so pleased to have him leading today's important discussion. And with that, Senator Frist, I turn it over to you.
Haley, thank you, and welcome to everybody. And Caroline, thank you for your leadership. And Dr. Williams, thank you for your sponsoring this event today. This is a real pleasure to have a conversation with one of the real icons in America today, but more importantly, somebody that we can trust, that we can honor because he tells us like it is. And he is everywhere talking to people, communicating, has a background in public health and a background, of course, in medicine itself. Vice Admiral Jerome Adams is the 20th Surgeon General of the United States, and he is, by being Surgeon General, our nation's doctor. His motto is better health through better partnerships, and those partnerships are a lot of what we will be talking about today. A lot of people don't know what the Surgeon General does. I didn't really until I went to Washington to join my colleague senators back in 1995. Dr. Adams oversees 6,000 uniformed health officers who serve over 800 locations, not just in the United States, but around the world. And they're out there, they're promoting, they're protecting, they're advancing the health and the public good and the safety of our nation. And we'll come back to how public health and security come together. As Surgeon General, he has created a number of initiatives to tackle the many pressing challenges we have today, the opioid epidemic, oral health, and the links between community health and public health in our economy. And also, as I suggested, community health, our health around us and our nation's security. We'll hear that he is also, and you probably know that already because you've seen him on television, as a member of the President's Corona Task Force, As I mentioned, has a degree in public health and as well as his medical degree and his background. In addition to that, and pertinent to a lot of the things we'll be talking about today, he knows public health by being a health commissioner of Indiana in the past. And while he was there, he led the state's response and the community response to things like Ebola and to Zika and to the largest HIV outbreak in the United States related to injection drug use. I want to spend a little bit of time on his background because of his breadth and his depth. And Dr. Adams, thank you so much for being with us today. And I would love to just turn the microphone over to you and I say thank you very much, but fill us in on a little bit of where you see the world today and our country today and our communities today as we address all of these pressing issues.
Great. Well, thank you so much, Senator Frist, for that too kind introduction. I really do appreciate it. And I just want to say to all of you, I appreciate the opportunity to serve my country. And that's what it's really about. I didn't plan on talking about this in my remarks today, but I just really think that public servants and public institutions are under attack like they've never been before in this nation. And I just want everyone to think about the sacrifices people make, whether it's a police officer or a fireman or your local legislator or your doctor or your nurse at the local county hospital. These are all people that could be making a whole lot more money elsewhere and really doing it with a lot less danger and inconvenience to themselves and to their families. And so not for my sake, because to me it's an honor to serve, but for everyone else out there, please take a moment and say thank you the next time you run into one of these folks. And when I say thank you to one of these folks, one of the people who I think most often of is you, Senator Frist. Really a lifetime of sacrifice and work on behalf of the people of Nashville, but on behalf of the people of the nation. And I have to share with folks that you're an honorary member of the Public Health Service, which I help lead. He didn't tell you this, but he was formally trained to administer the smallpox vaccination by former Surgeon General Richard Carmona, I believe way back in 2003. I got that little tidbit from one of my predecessors. And so it's great to see you still pushing to keep America safe and healthy. And hopefully we'll be able to formally train you in how to administer the COVID vaccine soon. And to the rest of you here today from Nashville Health, Nashville Healthcare Council, thank you for your efforts, not just to prepare for and protect your communities against this terrible pandemic, but also your work to improve the health and well-being of Nashvillians and beyond. Because the fact is, COVID has laid bare a lot of the concerns we've all had well before 2020 about health and well-being and the interplay between that and our ability to be vibrant as communities. It goes without saying, these are unprecedented times. We all know this pandemic has hit us hard, but it's particularly affected people of color, people with underlying conditions, and those who are older. And there are a multitude of factors we could go through to explain this, but from my standpoint, and there's good data to back this up, all of these reasons can really be boiled down to or rooted in social pre-existing conditions that conspire to reduce our resilience, our opportunity, and our health. We often talk about medical pre-existing conditions, but really there are social pre-existing conditions out there that are impacting our ability as individuals and as communities to be prosperous. And in a vicious cycle, these social determinants, things like transportation, childcare, safe and affordable housing, they contribute to medical determinants. Chronic diseases like diabetes, lung disease, kidney disease, high blood pressure. And so it should be no surprise that these diseases are more common in vulnerable communities, particularly communities with high degrees of people of color, but also that COVID is impacting these same communities. Because these social determinants make individuals more susceptible to infection with COVID-19, while the medical determinants that they also make more prevalent in these communities are associated with more severe COVID complications and death. And I want to take a quick deep dive just to give you an example. We know that social distancing and teleworking are critical to prevent the spread of coronavirus. I helped write the task force guidelines that say if you can telework, yet only 1 in 5 African Americans and 1 in 6 Hispanic Americans has a job that allows them to work from home. We know that when people are diagnosed with COVID or they're told that they've been around someone with COVID, that they're instructed to isolate or to quarantine. Well, people of color are more likely to live in multi-generational homes. So what does it mean to tell someone to quarantine or to isolate if you don't ask and deal with the fact that they may live with 6 or 7 or 8 other people in a 2-bedroom apartment sharing a bathroom? We know that factors such as these create greater risk for spread of a highly contagious disease like COVID-19 and make it harder for them to make the right choice. And that's the key here. We need to make the right choice, the healthy choice, the easy choice, or even just an option. Because for a lot of people, it's not that they're choosing to do the wrong thing, it's that the healthy choice that they know to be the healthy choice is either harder or is impossible. It's not even on the table for them. I noticed that the Tennessee Department of Health, their Office of Minority Health, launched a statewide health disparities task force to help address some of these disparities by improving the efficiency and effectiveness of information dissemination to communities. And I wanted to give them a shout out. I'm glad to see the task force involves community leaders, faith-based partners, academia, healthcare professionals, and public officials. Because like I always say, the way we will achieve better health is through better partnerships. Just as you're making headway here in Nashville, we're also making progress on a national level in fighting the pandemic. And I think this is important because every time you turn on the TV, you see the death tolls, the case counts. You see people arguing over how things have gone so wrong. And we need to acknowledge the missteps. We need to learn lessons, but we need to help people understand that we've made progress, because otherwise they will lose hope. And if they lose hope, they throw their hands up in the air and say, why should I even try? And that's what we're in danger of, particularly in the last few weeks leading up to the election, where again, a lot of the election discussions are revolving around the pandemic. We can both say that there's a problem and that it's tragic that people have died and that we need to continue to improve, but also acknowledge that efforts have been made to put us in a better place. And we are in a much better place than what we were in February, March. As of today, we've completed over 111 million tests. The national percent positive for the past 7 days, thanks to your efforts, is 4.3%. These two numbers are really tremendous. Our problem isn't that we don't have enough tests now, it's that we can't get enough people to come in and get tested. Testing turnaround times. In the past 7 days, 97% of commercial lab tests and almost 99% of all tests were completed within 3 days. Important for you all to understand that, because one of the reasons people aren't coming in to get tested is because they still think we're having 7 and 10 and 14-day turnaround times. No, in most cases, people are getting their test results back in under 48 hours, and in many cases, under 24 hours. These results are in large part due to opening of more than 500 community-based testing sites. We've opened up some right there in Nashville with the support of private sector partners and the Public Health Service, which I lead, and again, which Senator Frist is an honorary part of. 70% of these community-based testing sites were intentionally located in socially vulnerable areas as categorized by housing situations, race, ethnicity, income, and language barriers. This is a big deal. We literally looked at the CDC Community Social Vulnerability Index and said we are going to strategically deploy resources to those vulnerable communities. We need to continue to make sure we're engaging in these types of focused interventions in the future. And we funded testing at 94% of America's community health centers, which hopefully you know predominantly serve low-income areas and people of color. I talked about focusing in on the areas that are hardest hit. It's important to note CDC now requires all testing data reported by states include information on race, ethnicity, and zip code. That allows us to better understand how to identify and protect our most vulnerable communities. And a lot of the time I've spent in Tennessee has been around the opioid epidemic and other such topics. We knew back with the opioid epidemic that reporting was a challenge. And it makes it incredibly difficult to detect trends in real time and to deploy resources to where they're most needed. We need to continue to work to make sure data collection includes demographic information and that it's coming in real time so that we can respond appropriately. The Office of Minority Health recently funded a grant to Morehouse University for $40 million that supports information dissemination and linkages to care for racial and ethnic minority populations, very similar to the Tennessee Department of Health task force, but done on a much larger scale, because we recognize that we do need to continue working with community members and finding surrogates and really taking that extra effort to engage with people and meet them where they are. The administration's emphasis on public-private partnerships is allowing us to progress towards a vaccine, towards therapeutics and diagnostics at a record pace as part of Operation Warp Speed. And I've said recently it's made the news, but it shouldn't be a shock because we've been saying it all along. We are near the finish line for a vaccine. We have 4 different drugs in phase 3 trials in less than a year. That is nothing short of historic. Normally, drug development involves a series of sequential steps. Complete step A, then start step B, then start step C, and it can take years, sometimes up to a decade, to develop a vaccine. What I want people to know is that with Operation Warp Speed, these steps are being undertaken simultaneously with clinical trials in order to accelerate production of vaccines that pass the rigorous FDA efficacy and safety standards. We are not compromising one bit on safety and FDA standards. What we're doing is buying down risk. And so what does that mean? Give you a very real example. Yesterday, I was in Texas visiting a plant, a $150 million facility that's being stood up in 6 months. That would normally take several years to build such a plant that will have the capability of producing 20 million doses of vaccine in a single batch. Why? Because as soon as we get a vaccine across the finish line, we want to be able to immediately start production. Normally, you would wait until you finished vaccine trials and actually got it FDA approved before you would start thinking about and ramping up production. We're doing these steps simultaneously without any compromise to safety, but really accelerating the speed at which these safe and effective products will be available to you. But we all know, and this is critical here, having a vaccine that is safe and effective is only step 1. Ensuring all Americans have an equitable opportunity to receive the vaccine and promoting vaccine confidence are key to ensuring the protection of all Americans against COVID-19. I've often said it'd be a real shame if we actually did all this work and spent all this taxpayer money and actually had a vaccine that could stop the pandemic, but yet the pandemic raged on because people weren't able to get or weren't willing to accept a vaccine. So I want you to know we all have a role to play in helping everyone around us understand the importance of vaccines, and particularly of this vaccine. Vaccines work. They are the safest and most effective public health intervention that we've had in the last 50 years in this country. And they play an important role in preventing the spread of disease, but can only protect communities when all of those who were able to receive a vaccination are willing and able to do so. And I know Senator Frist published on this topic this past July. He and I agree that we must address vaccine hesitancy and barriers to people getting vaccinated. Many people trust their medical providers, so we've got to create opportunities for them to listen to concerns about vaccine safety and to provide the evidence about vaccine benefits and risks. And I've seen this happen and be effective in real life in Portland, Oregon, when they were having the measles outbreak last year. I spoke to a pediatrician who opened up an after-hours session to foster a dialogue with patients and families in order to better understand their concerns and increase comfort around vaccines. Some people had to go there 2-3 times before they got their questions answered, but the pediatrician told me that over 80% of the people who came eventually decided to get vaccinated. We need to meet people where they are and have these conversations in a compassionate way, because one of my favorite sayings is people need to know that you care before they care what you know. But I'd also remind you that New York City has a positivity rate less than 1%, and they don't have a vaccine yet. So while we are anxious for and await a vaccine, we don't have to wait to drive this virus into the ground. Our best immediate defense against this infection are what I call the 3 W's. Number 1, wash your hands. Number 2, watch your distance, meaning maintain at least 6 feet away from others and avoid crowded indoor spaces when you can. And number 3, always wear a face mask when you're interacting with people outside of your immediate bubble. While advances in testing and treatment are critical, the way we win the war against this virus is through individual behaviors, simple acts that have been proven to help us gain control of COVID-19. And this is another place I need your help, because as trusted leaders in Nashville and across Tennessee and the country, you are able to make a difference in how we navigate the reopening of businesses, schools, and communities. I want you to understand that people are going to be more likely to listen to you in your communities than what they are to listen to the Surgeon General of the United States or even the President of the United States or presidential candidates. We need you all to really embrace these 3 W's and reject the false dichotomy. It's not business versus health. It's that the way we reopen businesses in our economy is by driving this virus into the ground and by promoting health. Implementing the guidance that we have at coronavirus.gov in your offices, clinics, homes, communities will help protect not just those you know and love, but everyone across the great state of Tennessee and across the country. And they'll help us open and stay open. I want to finish by talking about a couple of products that my office is going to have out in the near future that are particularly relevant now in the midst of the pandemic. On Friday, I'll be releasing a call to action on maternal health. Hopefully you're aware of the shocking fact that 700 women die in childbirth each year. That's a woman every 12 hours in this country who's pregnant or who has just given birth dies in this country. That's a higher rate than any other developed country. And when you look at Israel, it's 8 times the rate of Israel. It's twice the rate of Czech Republic. And here's what's shocking. Over 60% of these deaths are preventable. And Black women and American Indians and Alaska Natives suffer more complications and a 2 to 3 times greater chance of mortality. The health of our nation depends quite simply on the health of our mothers. And so I'm asking you to read my call to action when it comes out, disseminate it, and ensure uptake of the recommendations in the call to action. And there are recommendations for employers, for payers, for healthcare systems, for providers, for mothers and mothers-to-be, and for people in communities, because we all have a role to play if we want to turn around some of these terrible statistics. And next week, I'll be releasing a second call to action on hypertension control for all Americans. I'm so proud of your work on hypertension control in Nashville and applaud Nashville Health for choosing this as a priority focus and for the way you're combining community and clinical actions to increase control rates. So I really hope my hypertension control call to action will allow you to re-up a lot of the work and recommendations you all have right there in Nashville, because hypertension is common and it's costly, but it's treatable. Unfortunately, national control rates are low and stalled. Less than half of people who know they have high blood pressure have it under control, and disparities abound. This leads to largely preventable and now rising rates of heart attacks, strokes, kidney disease, heart failure, and maternal morbidity and mortality. And guess what? The #1 risk factor for early deaths or for deaths from COVID-19, hypertension. So again, maybe we can use this terrible tragedy to put a little wind in our sails and lower the rates of hypertension, because 10 times as many people are going to die in 2020 from hypertension and related diseases as will die from COVID-19. As sad as any individual death is, I think we need to remember that there's a lot of work to be done out there beyond a focus on COVID-19, and a lot of it is overlapping and will help both. The final product I want to tell you about is my report on community health and economic prosperity, and I was just talking to the Texas Chamber of Commerce about it yesterday. It's really a report that's designed to help people understand the interconnectivity between community health and our ability to be vibrant, successful as businesses, as individuals. Number two cost for most businesses is healthcare expenses. Unhealthy communities lead to more absenteeism, lower productivity, decreased workforce, increased turnover in those workforces. The fact is our competitiveness as a country and as businesses is suffering because of the poor health of our nation. And COVID-19 has really shown that in stark detail. This report will list examples of companies around the nation that have really leaned in to different policies and different interventions at the local level that will allow them to promote healthier communities and then in turn have a healthier bottom line. And I'll give you just one really quick example. Belden is a company in Indiana. They had to interview over 200 people to fill a single position because every time they'd offer someone the job, they'd come in and fail the drug test. So instead of waiting until they'd gone through interview, hire, and then drug test, they drug screened people up front. And if people actually failed the screen, they connected them with treatment and recovery programs in the community so that they could go in for free. And if people successfully treated these programs, then Belden held a job for them. And guess what? The people who complete this program actually miss less work, have lower turnover rates, are more loyal employees and more productive employees than people who don't have a diagnosis of substance use disorder. So again, this is an example of a win-win when we promote community health. It doesn't have to be one versus the other. So I want to close by giving you some reasons for hope in the midst of the COVID-19 pandemic. Number one, we're almost over the finish line for a vaccine. Talk to Tony Fauci, talk to Deborah Birx regularly. We all still believe we're going to have a vaccine by the end of this year, beginning of next year. We've just got to get people to actually take it. We know much more about who is at risk and why. And we've been able to better protect them because of it. The death rate amongst older people and amongst all people has come down significantly. Overall, it was 30% in March and in April. If you got COVID, the chance that you would die. Now it's down to less than 5%. We know much more about how to treat those most severely affected. We've got remdesivir, we've got steroids. We changed our ventilation practices. And so now length of stay in the hospital is much shorter and your chance of getting out of the hospital is much increased. We know that we have to address the underlying drivers of disparate outcomes, the social conditions that limit or unleash a healthy future. And you've seen that come to bear in the midst of COVID with rent protection and eviction protection policies in many communities. You've seen support for people so that they can stay home and actually telework or do the things that we know will allow them to make healthier decisions. We need to build on that and expand that out to other diseases and other risk factors. And we know what works to keep people in their communities safe. I launched a campaign called #COVIDStopsWithMe because we all have a role to play in preventing the spread of this virus. I'd encourage you to visit my Twitter account @Surgeon_General to watch my video speaking about this and share it within your networks. But again, it really comes down to washing your hands, wearing a mask, watching your distance. You can drive this disease into the ground even without a vaccine. Final point I want to make to you that I want to beg you to do is to get your flu shot and encourage your family, friends, and colleagues to do the same. This will be our most important flu season of our lifetimes. Why? We can't afford to overwhelm our healthcare systems because every patient who's admitted to the hospital with flu is taking up a bed for someone who could be coming in with COVID. You also have to understand that the symptoms for flu are the same as the symptoms for COVID. So if someone with a mild flu comes into your building and you temperature screen them and they screen for a fever, you're going to have to send them home and you're going to have to shut down anyone and everything that they've been around until their COVID test comes back. So the false positive for COVID that could be mild flu, again, can have an incredible disruption on your community. And then finally, I think the best predictor of who gets the COVID vaccine is going to be who gets the flu vaccine. It's a great opportunity to help people have a conversation with their health providers about the safety and efficacy of vaccines and prime that pump. The flu cost every county across America $2 million in lost productivity, absenteeism, and indirect and direct healthcare costs. That's $2 million that's not going to your economic development at a time when counties are hurting. We can really, really help our communities, both from a health standpoint and an economic standpoint, with a flu vaccine. And I know you all are ready for me to be done and to wrap this up, but I want to put a bow on this whole flu vaccine thing. We're having a social justice movement in this country right now that started because of law enforcement encounters and people getting killed in these law enforcement encounters. This is a tragedy, an absolute tragedy. I want you to understand 1,000 people total in the United States die every year in a law enforcement encounter. About 300 of those are brown and black people. Every single one of those is a tragedy. That sparked a social justice movement, the likes of which we haven't seen since the 60s. 40,000 plus people die every single year from the flu, and they are disproportionately black and brown. So why don't we have the same level of engagement and outrage about the fact that black and brown communities are differentially not getting their flu shots? You would save thousands of lives if we could achieve some equity in that space. So please don't misunderstand me. I am in no way, shape, or form diminishing the energy around social justice that's going on right now. What I'm saying to you is that we need to have that same energy when we look at health measures. The flu shot is the simplest, easiest, cheapest way that you and your community can help achieve a greater degree of social justice, because without health equity, there is no social justice. So I just want to say, it's been a challenging time, but as folks often say, with tragedy often comes opportunity. The greatest innovation, the greatest advances in health and in health policy in our country, they've come after wars. Whether it's a blood transfusion therapy, whether it's the expanded use of antibiotics after World War II, whether it's our advances in trauma care after the Gulf War. And we're at war with this virus now, but I remain steadfast in my resolve to use our lessons learned, our scars, our losses, our sorrow as a once-in-a-lifetime opportunity to recognize the fundamental errors in our system and to make our communities healthier, more resilient, and more just moving forward. So thank you for the opportunity, and I look forward to questions. I see some are rolling in, but I'll turn it back over to Senator Frist to moderate.
Good, thank you, Dr. Adams. And let's go a little bit deeper. First of all, thank you for being comprehensive and touching on so many of the topics that are current, that in our own homes, that we're thinking about. When you read media, especially social media, but really all the media today, you don't know really who to trust, and really what are the facts, and what do those facts mean to me as I'm in my position. And what your conversation does is really takes us from that to our community at large, our responsibilities, the importance of working together, of staying aligned, of partnerships. And let's explore a couple of those things that you brought up. And on this particular call, we have hundreds of leaders. And what is a leader? A leader is somebody, all of us are leaders of some sort. But on this particular call, because of the announcement that was sent out and the populations it was sent out to, there are a lot of leaders, and they're leaders and doctors and nurses and leaders of healthcare companies and other companies. So I want to talk a little bit about leadership and what leaders can do in their entities or in their businesses, and a little bit about trust. You mentioned trust, several times. You opened with trust, and that we're at a time of distrust of our institutions itself. So first, trust. The Nashville Health is a collaborative here, as you know, that brings together a whole bunch of people from all different constituencies. The diversity is representative of our community. And we did a community and well-being survey before COVID as a baseline. It hadn't been done in 20 years. Most communities don't do it, haven't been able to do it. Ours was comprehensive, went to the community, all parts of Nashville. I didn't really study some of the responses to questions as much as I should have until COVID hit. And I went back and looked at the data. And we looked at a lot of questions about social determinants, non-medical determinants, access issues. And when you started looking at it, some surprising things. And number one, trust. If a person of color in our community goes to interact with healthcare personnel, a doctor, a nurse, a physician assistant, a physical therapist, walking into that office, they have 3 times compared to all others, the sense of discrimination, of that there's something because of my color that's going to interfere in this engagement. And that was in our survey. These are people self-reporting, and those represented thousands of people. It's real. So when we take that, and we know that part of that is the trust, but what does a community like ours do? Look at these partnerships and the discussions like we're having today to reverse that, where a person of color coming into an office doesn't start with that bias. And it's a long, long question, but are there 2 or 3 things that you could throw in that we should be thinking about as we listen to you?
Well, I'm so glad you mentioned that. And it's a great place to start. And a couple of things come to mind. Number one, I hope you all write up and publish in a peer-reviewed journal the results of your survey. Because one of the challenges that I face, and you can attest to this, sir, is there's our experiences, but when it comes to Congress and us wanting appropriations for certain things, we've got to be able to show people, look, there is hard data that says that this is the case and that it's going on in a peer-reviewed journal, so that then we can justify and convince people to spend taxpayer money in a way that will address those concerns. And I'm dealing with this right now, maternal health, the report that I'm putting out. We know that Black women are 3 to 5 times as likely to die as white women. There's during the time of childbirth, and that's when you control for every other factor out there. A college-educated Black woman is still more likely to die than a white woman who didn't finish high school. And but yet there's still a lot of debate out there about whether or not this really reflects bias and racism in healthcare encounters, and we need to publish this. So that's number one, I think critically important. Number two, we need to pay attention to the pipeline. There are less Black men going into medical school now than what there were 40 years ago. I'm going to say that again because I want everyone to hear that. There are less Black men going into medical school now than what there were 40 years ago. And we know from the data, the published data, that ultimately, no matter what the color of your skin is, you are going to have a more satisfying healthcare encounter and be able to let down your guard and engage with people and trust them if they come from your community, if they think like you, if they look like you, if they talk like you. So representation matters, and we shouldn't be going backwards. We should be increasing the diversity of our healthcare workforce because we know the population is increasing. So this problem is actually only getting worse, not just because of the raw numbers, but because the population is moving further away from what the healthcare workers look like.
I want to pick up on that because I think that is so important. We know these disparities. A lot of people don't know the disparities exist. You do, I do. We study it, public health. It's there. And a disparity is an inequality, an inequity. So it comes back to giving opportunities. So the question is how we actually move there. And I think you hit on a great point. We're blessed here in Nashville, Tennessee, to have Meharry Medical School, which, as you know, has a huge history. And up until about 6 years ago, it produced more physicians of color than any place in America. Now it's changed a little bit, but still. And Dr. Hildreth has been a great voice working with our mayor here in Nashville. And I think not until we saw his voice because of COVID and his authority and what he's contributed, did the broader community really appreciate as much this great resource that we have here. And I just add, I think starting at college and encouraging people of color to go, to start in high school, and to start in doing mentoring programs if you're a physician and you're going to a local school and you're a physician of color, that will inspire people in ways to continue that pathway. So I really appreciate that.
I'll tell you really quickly, because a lot of people don't know this. Some of you probably heard me tell this story. I had a 4.0 grade point average throughout most of my K through 12 education. I never dreamed I could be a doctor because I grew up in a rural area and I never met another Black doctor. I'd never met a Black doctor until I got to college and met Dr. Ben Carson. It is incredibly important that we look at pipeline, that we look at mentorship programs, because even if you have the skill set, and I had a 4.0 GPA, if you don't see it, you don't believe that you can be it, to your point, Senator. And you're right, we need to leverage the HBCUs, the people that are in the community. We need to support them because here's another interesting thing you'll appreciate, and we have some academic folks on the phone. I tried to do this at my institution. I worked at an academic institution for 10 years before I became Surgeon General. I was told that when I went out to volunteer in the community, when I participated in these events, I had to do it on my own time and that it wouldn't count for promotion for me the way sitting in a lab and writing a paper to get published, an academic paper to get published, would be counted towards promotion. So when you say, what can we do as leaders? We need to look at the array of different ways that people can give back to their communities. And we need to support the individuals who need mentors and the people who can be mentors, because there's a lot of disincentives in the system right now, which is why I think the pipeline is falling apart instead of going in the right direction.
Thank you. I'm going to go to questions that are coming up on the chat room as well, and I'll pick out a few as we go through. There are a lot of leaders on the call now. Are there, and you're at the chamber, I think you said the chamber in Texas yesterday, corporate leaders, people on boards, people who are running companies, a lot of healthcare companies, again, on this particular call. Is there anything in the disparity issue and the equity issue, the CEO who has a bottom line and they have shareholders and their mission may be something totally different? Are there any examples of either companies who are doing things well in that regard, or any advice to those leaders who might be listening now?
Love that. And again, what I would say to you is stay attention for my Community Health and Economic Prosperity report, because there will be examples, but I mentioned Belden. There's another one called Greyston Bakery in New York that hires 70% of their people are folks who were formerly incarcerated. So a lot of you as businesses are having trouble with workforce. Well, guess what? We throw away a lot of people out there who could be productive and will be loyal if we take a little bit of time and give them skills training. Bank of America, who I worked with in both Hyatt, looked at their entry criteria for a lot of these jobs, and a lot of them say you need to have a college degree. Well, I think we all know that very few people are actually working in the area of their college degree, and that in most cases you have to train them up for the job anyway. So why do we have a college degree as an entry barrier for people coming in? Did my intramural softball class that I took in college really make me better suited to work in a particular position? Bank of America and Hyatt went through all of their jobs and really said, look, these ones don't need a college degree. We can actually remove that as a requirement and then put in additional skills training. Chobani, very mission driven. I went out and spoke to the leaders of Chobani. They make yogurt, and they said, look, we're a food company. So we looked at food insecurity. We looked at food sustainability. We tried to work in a space that we as a company were familiar with. So you can go with a place that you're passionate, or you can go in a place that fits with your mission. But ultimately, what I want people to know, and the Business Roundtable actually said this, they changed their mission statement. Remember, it used to be from the Business Roundtable, the Fortune 500 CEOs, that your job as a head of a company was to maximize shareholder return. They changed that. They said, you need to start looking at stakeholder return in the entire value chain, because if your suppliers aren't healthy, then you're going to have a shortage and you're going to be running into trouble. If your customers aren't healthy, then they're going to stop buying your products because they're in a pandemic and they can't afford to buy it, and that's going to hurt your bottom line. If your community is not healthy, then you're not going to have a healthy workforce from which to draw from. If your employees aren't healthy, then they're going to miss work. They're going to be less productive while they're at work. And it's not just your employees. As you all know, but it's worth reiterating, over a half of the cost that employers pay in healthcare expenses aren't the actual employees, their spouses and kids. So you need to worry about the entire environment, the school system, where the spouse is working, and create a healthier community. And you can do it without a whole lot of effort. CDC has what they call their High Five initiative, which are 5 interventions that have been proven to have impact from a policy perspective. Instead of giving someone $25 off for quitting smoking, you're going to have a greater impact by showing up at the town meeting where they're debating a clean air policy, because that's going to have a bigger influence on whether or not someone can quit smoking than whether or not you give them a few dollars off of their deductible. When you talk about obesity, encouraging the city to build a park or to build in sidewalks so that there are complete streets are going to have a much bigger impact than, again, some of these downstream initiatives that we look at, giving someone a few extra dollars if they can shave some points off of their BMI. We need to make the healthy choice the easy choice.
I want to jump in with a couple of questions. We got a lot of questions coming in from outside.
Oh, great.
Dr. R basically says, we have seen social media contribute to misinformation about the pandemic. How do we make sure we're relying on trusted sources when it comes to our health? I think that's especially important as you talk about the flu and the hypertension and diabetes and maternal health. You know, who do you trust? What do we do in the social media world and without?
Well, I think number one, we need to continue to facilitate the conversation between patients and people in communities and their local providers. Because when you look at Gallup polls consistently, the person that people say they most trust is their doctor or their nurse. And the more we can facilitate those conversations, the more people will get the truth. I think we need to try to keep politics out of these discussions. I'll do a really super quick experiment. When I say hydroxychloroquine, when I say wear a face mask, when I say get vaccinated, in many cases, what's triggered in your head isn't a health conversation or a health reaction, it's a political reaction. And we need to depoliticize a lot of these issues so that we can actually have a real conversation. And then we're really still trying to think through how we leverage social media for good. I'm happy to see that more and more health providers are engaging in social media and getting information out there. I worry that they're mixing their health messages with political messages all around, and that may be discouraging some people from trusting them further. So I would just say that to those out there who are health providers, be clear which hat you're wearing when you're speaking, because when you mix those messages, you can actually hurt your credibility with people who otherwise might have trusted you.
There's several questions about vaccine, and we hear so much about it in the public, and great progress being made, and Operation Warp Speed doing well, as you opened with as well, talking about the manufacturing is underway, and that's unprecedented. When I wrote about this in 2005, the vaccine was going to be the biggest challenge. And in truth, this administration has said, while we're trying to figure this out, putting $10 billion in, we're going to start the manufacturing, even if we don't know it's going to work. And if it doesn't work, we'll just stop it and change it. So that's very encouraging. The vaccine, and nobody knows the answer to this, and it's dangerous to say, but will it be the middle part of next year before people will have access to vaccine? I don't really know, but what's your gut based on all that you hear in Washington as you go around?
So great question. The way I'm going to answer that is the way that Admiral Giroir answered it a few weeks ago on Good Morning America, because I believe this to be true. Number one, it's going to take a while for us to roll up, to scale up and roll out 300 million vaccines. But that said, we can get 80% of the benefit from vaccinations by vaccinating the right 20% of people. We want to make sure when you look at the National Academies of Science, Engineering, and Medicine report that came out about 3 weeks ago, that we are prioritizing healthcare workers and frontline workers, because they're going to be the ones most likely to get the disease, but they're also encountering other people and likely to spread it. The next tier, we want to make sure we're protecting the vulnerable, because we can get more impact if a person who is at higher risk for complications is first in line to get the vaccine. So it may be well into next year before we get everyone who wants a vaccine. But if we really work strategically and think now about who would most benefit from the vaccine from an individual safety perspective of protecting them from COVID, but also from a community spread perspective, we can get a lot of the benefit in just a few months by employing that strategy.
Another question that came in that I think about a lot as well, and involved in talking to some of the leadership, is comes back to the trust. And you mentioned trust in institutions early on. The CDC, and just because you're a physician, you probably have to be really careful. So we can just use CDC as an example. Has lost a lot of trust. And it's something that hurts you and hurts me because the CDC has always been the gold standard. It still is in terms of the very best science, the very best epidemiology, the very best, wisest, smartest, most experienced people in the world, not in the United States, are there. But how long will it take? How do you go about restoring that trust in these institutions? You don't even have to comment on the CDC itself, but how are we going to restore that trust in this environment of fake news and social media? Trust in institutions like that are absolutely critical because we will have other viruses. Mm-hmm. Viruses are smart enough. There will be new ones you've been involved with or on the front lines, and there will be more. So we have to come back and build this trust. How are we going to do that as a community and as a nation?
Well, that's one of the big concerns that I have is that we've been attacking these institutions. I'll tell you something very personal. I hope you're going to find the narrative change significantly after November 4th. And I hate to say that, but again, a lot of this is so enmeshed in politics, and on both sides, it was determined way back in March and in April that this election was going to be decided based on how you could frame the handling of this pandemic. And so that is a challenge that we have. And I just say that because I want people to try to resist that temptation over the next several weeks to attack institutions back and forth. But the other thing we need to do as leaders, particularly health leaders, is help people understand the process. And vaccines is a great example of this. There is an FDA process. There are independent data safety monitoring boards and IRBs. And it doesn't matter who you are, you can't influence that independent data safety monitoring board. So instead of having a discussion about whether or not you trust what a certain political leader is saying, we should be having a discussion about the protections that are in place to make sure the process plays itself out. And then the final thing I would say to people is we need to help people understand we've learned more about this virus in 9 months than we've learned about any other virus in 9 years. It took decades for us to get where we are with HIV care. We've gone from not even knowing this virus existed to having therapeutics, to having multiple vaccines ready to come across the finish line, to understanding more about its spread in 9 short months. And I'll be a little bit self-deprecating. You mentioned CDC. Everyone hassles me for what I said about masks early on. I own that. What people don't understand is that the way science works, science is actually wrong more than it's right. Science isn't about always being right. Science is about looking at the evidence that's in front of you and making the best recommendations or the best conclusions you can based on evidence, but then having the courage, the vigilance to continue to look for new data, and then having the humility to change your recommendations when that data comes out. So, for instance, everything we knew about coronaviruses up until January told us that there was a very low chance of asymptomatic spread. Senator, if you have a cold and I'm in a room with you, I'm likely to know it because you're going to have a sniffles, red eyes, a fever. If you and I are in the same room and you have coronavirus, there's about a coin flip chance of whether or not I will know it or not. And so we made the recommendation not to wear a mask based on the best available evidence, which is what science says you're supposed to do. Then we tracked the data, and as soon as we saw the data was telling us something different, we changed our recommendations. That didn't mean we were nefarious. That didn't mean we were incompetent. That meant that we did exactly what science says we're supposed to do, but we're seeing science move at literally a warp speed pace. And we need to help people understand that politics aside, things are going to change. That doesn't mean you shouldn't trust people or the process.
Well, we just have a couple of minutes, unfortunately, because this has been so interesting to me. I really appreciate it. But public health and national security. People are individuals when they turn the video off and go back to their work. It's hard for them to think that their behavior, what happens with this virus, they know what with their children and their personal security, but national security is not something that a lot of people think about. Just give me your 2 minutes on that, and then we'll have to wrap things up.
Well, one of my priorities is health and national security. Why? Because the number one issue people vote on is jobs in the economy. But the number two issue people vote on, Democrat or Republican, black or white, rural or urban, is safety and security. And we are, quite frankly, a less safe nation because we are a less healthy nation. One example is the opioid epidemic. You're at higher risk for property crime because we haven't dealt with people's underlying mental health issues and adverse childhood experiences, and they're self-medicating. The military right now is dealing with the nation's obesity epidemic. We can't get people to join the military who can pass the physical because the community is obese. We also know that with COVID, I was at the National Defense Chiefs Conference in Hawaii about a month back. Our soldiers are being denied entry to other locations, other countries, because we are considered to be at higher risk for bringing the virus into their country. So again, when we don't pay attention to these basic health issues, it actually impacts our safety, our security, and our economic prosperity. And we need to help everyone understand that, because then that will help people understand the importance to the community, not just the individual. It's one thing for you to say, well, that person's obese because of bad decisions. That person's an alcoholic because of bad decisions. And that's not true. But that said, a lot of people think that. If we want to convince them, we need to help them understand, look, what happens to them ultimately impacts your safety, your security, your ability to have jobs in your community, your own personal success. And then my hope is that will encourage people to make the investments and the policies and the funding mechanisms that will lift everyone up. That's what my CHEP report is all about. That's why I've worked with the Surgeons General of the Army, the Navy, and the Air Force on obesity and on tobacco, and why we all need to come together around COVID. And if we do that, then we'll have a safer and more secure and a more prosperous nation for everyone.
Dr. Jerome Adams, I think closing with that, being another one of the issues like the healthcare disparities, not just pointing it out, but that there are things we can do, which we talked about today. And then also an appreciation I think people do have of the importance of public health, of population health, of health of communities, that it is in some ways very different than the health of the individual, but it does have that impact on community, on well-being, on a state's economy, and on national security. And we've touched on a lot of those things today. And on behalf of all of our audience, I want to thank you, from as physician to physician, as policymaker to policy implementer and leader, for your service. With that,
and as surgeon to anesthesiologist, I mean, we could work together in the operating room sometime. I'd still love to. I don't know if you still sneak in or not.
I depend on you when I'm doing that incision. Haley Hogan's.
Well, thank you both so much for today's discussion. It was absolutely fascinating. So appreciate all of these answers to really important questions that are facing us right now, particularly as we discuss and continue discussing issues around health equity. I want to once again thank Dr. Herman Williams for being the person that is sponsoring this event. Again, thank you for being a change agent in our healthcare community here in Nashville. Senator Frist, Dr. Jerome Adams, thank you so much for such an amazing conversation today. And
thank you, everyone. Be well, get your flu shot.
Absolutely, that was my #1 takeaway. Thank you all.